Hi, I'm Dr. Joe Alaimo, and I'm a board-certified chiropractor, and I'm also a certified gluten coach. So for some of you that have tried gluten-free diets or tried to go gluten-free and have been unsuccessful, I'm going to reveal to you some of the reasons why that's happening. Okay, first of all, when a lot of my patients come in and they say that they've been gluten-free, they kind of think that they are gluten-free, but being gluten-free is kind of like being pregnant. It's either you are or you aren't. You can't be in between. So as long as you cheat or have accidental exposure, even one time in 30 days, then you're not gluten-free, first of all. Second of all, there's a lot of hidden sources of gluten, and that's where it's really important to understand the different names for gluten, why, again, certain fillers in medicines, certain fillers in vitamins, a lot of these different things contain gluten, and though you may not be eating the traditional wheat, rye, barley, and oats, you may be getting gluten exposure in other ways that you don't even know, like a thickening agent in ketchup, modified cornstarch. Things like that can also lead to patients having gluten problems, especially if you're gluten sensitive. Number two is that patients with gluten sensitivity, sometimes they'll try it, or even if they're not gluten sensitive, they think they might be, they may try a gluten-free diet for 2 weeks, not get any results, and then decide that they're not gluten sensitive. And that's really the wrong way to do it, because if it's taken you, if you've had gluten and you've had sensitivity for 30 years, does it make sense that you're going to get better in 2 weeks by being off gluten? Probably not. The third reason is a lot of times when patients go gluten-free, they don't repair the gut lining. They don't repair the damage that's been done, that the gluten's been doing all these years. And they've done studies where 10 years after being on a gluten-free diet, 50% of these patients still had leaky gut or gut problems because they didn't repair it. I always tell patients it's like if your house is on fire and you put the fire out, yeah, that's great. That's getting rid of the gluten. But you have to go in there and rebuild it, don't you? And everybody kind of gets that. It makes sense. So if you don't repair that gut lining, it's not going to get better. Also, gluten is been very implicated, obviously, in celiac disease and certain other conditions. But right now it's been linked to 140 other known diseases. So again, if you're suffering with something that you're not sure, understanding gluten sensitivity and going gluten-free is really important for you and your family. The other thing that I want to cover was why patients maybe don't respond on a gluten-free diet is something called cross-reactivity. Now what that means is that if you have a sensitivity, say you don't have a sensitivity to dairy, but you may have a cross-sensitivity, a cross-reaction with gluten. What that means is that every time you have dairy, your body looks at it like gluten. So again, not a traditional dairy sensitivity, but your body's reacting to it as if it's gluten. And the other one, another big cross-reactive food is coffee. Now I know that shocks you and everybody loves their coffee, but if when they've checked this out in the lab, the most cross-reactive food, or one of the most cross-reactive foods, meaning that when your body ingests it, it sees it as gluten, is coffee. So how do we know what the cross-reactive foods that are reacting with you are? Well, we run specific tests. We run a Cyrex panel, which is a very specific lab test that lets us know what foods your body is cross-reactive to. So again, if you want to find that out, we can run the labs here. It's a highly specific test with very high sensitivity. Other patients that just want to know if they're gluten sensitive prior to starting a gluten-free diet, we also offer very highly specific and sensitive tests for that. Not your traditional lab test that you get through some of the other labs or some of your other doctors, but a very specific test that will measure many different aspects of gluten to determine whether or not you're sensitive. So wrapping it up, in order to understand gluten sensitivity and why you may not be doing well on it, is you have to understand hidden sources of gluten, accidental exposure to gluten, cross-reactive foods to gluten, and other gut-related issues that make it really imperative to understand what's going on. Remember, celiac disease and gut issues is only one manifestation of gluten sensitivity. It affects the brain, it affects the neurological system, and it's primarily a neurological disorder. So I just wanted to touch base on this because a lot of patients have questions on gluten, and if this is something that you're interested in, you want to learn more about the testing, you can go to cyrexlabs.com, look that up. If you want to get someone to order the test for you and to interpret them, we're here to do that for you. So again, call us if you need us, 910-251-1620. Thanks and have a great day.